Hi, I'm Douglas DiRuggiero, and I'm a physician assistant who practices dermatology in Georgia, something I've loved and have done for the last 26 years. And I'm welcoming you now to Grand Rounds in Atopic Dermatitis. I'm going to start us off with photos of two different patients of mine. You can see the anterior thighs on a 10-year-old, and you can see the posterior knee here on a 12-year-old. Now, it's not going to be a stepwise fashion on this is what happened. Here's at 1 week, here's at 2 week, here's at 3 week. It's more saying, what are we doing with these patients that are greater than 2 years of age, that are up to 12 years of age? What categories and what therapies do we have once they hit this age limit of 12 that we can have? I find that atopic dermatitis begins to favor the classically described areas of atopic dermatitis and the popliteal fossa, and it becomes more lichenified and excoriated in this age category. So there's an evolution towards more of an adult presentation I see in this onset of this category. The question is, what do we do with these paradigms? What do you do for someone who's age 8 versus age 12 versus age 18? And so I think it's important for us to talk about what those options are. Certainly in this category, when we're talking about someone who's not yet a full adult, not 18 and up, right? Because we have different things that are approved at age 12, different things that are down to age 6, some down to age 2, and some down to age 6 months. But what we have here is we still have oral steroids and dupilumab that's 6 months and up, right? But several other great systemics become available to us when we hit age 12, right? So that's there, right? That's what I call green thumb dermatology, planting a seed. Even if you're going to start off with some excellent topicals, a good regimen, an eczema plan, you want to be planting that seed so that in case the systemics are something we have to head towards, you're beginning to open the parent up to the idea of treating this inside out disease with something on the inside. We know that crystal boral is down to 3 months of age. It is our steroid-free option. But when we go beyond age 2, suddenly we have these fantastic novel steroid-free topicals that have become available to us. Topical ruxolitinib, tapinarof, roflumilast, the TCIs. And so now we have this whole host of different arrows in the quiver that we can come at this disease and be able to mitigate and reduce the exposure to topical steroids, which is really what we want to do. We love steroids in terms of having them available to us, but we have to have a healthy respect for them. So the topical steroids often overused, maybe more so by our primary care colleagues, but even so much so in dermatology. And then we have home and integrative remedies. So what did I do with the patient that you saw on the right in the popliteal fossa area? So this is an excellent case for me to look at this body surface area that's under 20% of BSA, and I introduced the idea of using a steroid-free medication that helps modify the disease by kind of like, I view this topical JAK inhibitor, topical ruxolitinib, as controlling the thermostat within the cell. What it is doing is it's beginning to normalize that systemic inflammatory response. So I had this young girl, who was actually 12 years old, wrote her for ruxolitinib, 1.5% cream twice a day. Man, she had a fantastic response. I had her come back in 2 weeks, and she says, I stopped itching about 24 hours later. The rash was not even raised or scaly after 3 days. And when she came in to see me, there was barely any faint erythema that was there. Very, very happy. Began using it, of course, in other areas on her arms and the base of her neck and other areas where she had. So this is the power of having these new novel steroid-free options that we can give our patients, and we have the comfort level of knowing that they can use them in areas that don't have to have a complex regimen. Use this steroid at this weak potency in your face and the strong one on your body and this different one in your scalp and this one here and there. These are something that can be used in all of these different areas, one potency, one strength, and very, very nice to have that.